We all know the quiet dread of waiting to sit in this chair. There is the clinical hum of the equipment, the overhead light, and for many, the even sharper anxiety of the final calculation waiting at the reception desk. That pressure is rising. In April 2026, NHS dental charges increased by 1.7%, adding another layer of complexity to rules that already shift every April based on your age, your income, and your location. Misinterpreting those rules carries a specific price. If you mistakenly claim an exemption from paying for your treatment, the NHS can issue an automatic £100 penalty fine, which is added directly to the cost of the dental work itself. Managing these costs requires a look at exactly how the NHS calculates its 2026 fees, and how those fees change depending on where you live. In England, the system is built on a single fixed fee for an entire course of treatment, rather than an itemized bill for every individual procedure. This three-tier pyramid shows how those fixed fees are structured. The base tier is Band 1. For £27.90, this covers foundational diagnostic work, your routine examination, clinical advice, and any necessary x-rays. Patients often expect a scale and polish at this level, but it is only included if your dentist decides it is strictly necessary for your clinical health, rather than for cosmetic reasons. Moving up to Band 2, the fee rises to £76.60. This covers active restorative treatments, including the actual repair work of fillings, root canals, and tooth extractions. Under this system, the price remains at £76.60 for that entire course of treatment, whether you need one filling or three. The highest tier is Band 3, priced at £332.10. This covers complex laboratory work, like custom crowns, bridges, and dentures. It also absorbs any necessary treatments from the lower bands. Because the final bill is capped at the highest band required, a patient needing a checkup, 2 fillings, and a new crown will pay exactly £332.10 for the entire process. However, these specific figures stop at the English border. Depending on your postcode, the price of identical dental work fluctuates across the UK. Looking at Wales on this map, we see they use the same 3-band structure, but at lower rates. A complex Band 3 treatment here caps out at £260, which is over £70 less than the equivalent treatment in England. In Scotland and Northern Ireland, the fixed bands are replaced by a cost-sharing model. As visualized by this pie chart, the patient pays 80% of the itemized cost for each specific procedure. To prevent bills from escalating, both nations enforce a strict safety net. No single course of NHS treatment will ever exceed a hard cap of £384. Patients in Scotland and Northern Ireland also bypass the initial charge English patients face. Routine examinations in these nations are completely free. Geography dictates your financial exposure, meaning a patient in Cardiff must budget for a crown differently than a patient in Edinburgh or London. For patients approaching or living in retirement, qualifying for free NHS dental treatment depends on meeting specific, narrow criteria. This split-screen comparison highlights a distinction that often triggers penalty fines. On the left, if you receive pension credit guarantee credit, your NHS dental treatment is completely free. On the right, if you receive savings credit on its own, you have no automatic dental coverage. Ticking the exemption box based on savings credit alone is what leads to those £100 penalty fines. For those who miss the pension credit credits but live on a modest income, the NHS Low Income Scheme provides an alternative. Applying for an HC2 or HC3 certificate can provide full or partial help with these costs. Because the system requires exact qualification, assuming that your age or a basic state pension grants you free healthcare is the most common route to an unexpected bill. Once you understand these mechanics, you can use the rules to actively manage your long-term dental costs. Strategy 1. Adhere strictly to Band 1 checkups. Catching minor decay early at a £27.90 appointment prevents the need for the £332.10 Band 3 restorative work that follows neglect. Strategy 2. Question the treatment plan. Ask your dentist if a Band 2 alternative exists. For example, an extraction at £76.60 may be a viable medical option instead of a £332 crown. Strategy 3. Manage your cash flow. If you do need Band 3 work, many NHS practices allow you to split the £332.10 bill over 2 or 3 monthly payments. Finally, verify your exact exemption status before signing any clinic forms. Check with the NHS BSA or call their helpline to confirm eligibility for free care. When you treat an NHS dental visit as a predictable financial transaction, you ensure that both your oral health and your bank account remain protected.